Good afternoon, everybody, and thanks for being with us. I'm Will Dupree, coming to you from the KXAN Live studio. We appreciate you being with us on this sunny Friday afternoon, and we're going to be talking about a simple health segment that is focused on something that's related to a lot of people's health out there and something that might affect them too. And we appreciate you being with us for this live stream. We try to bring you these conversations every Friday. And joining me, as always, is our KXAN producer, Jose Torres. Jose, thank you for being here and for sharing the story.
Yeah, good afternoon, Will. Thank you for having me.
So let's set this up for everybody. This is about an insulin treatment that could help some diabetic patients out there.
Yeah, so there's a couple of options regarding treatment. There's insulin injections. There's also pumps that just deliver the insulin to you without. They take the guesswork for you and they just pump it up automatically. But this option is different if you want to try something different. There you see it's like a smaller version of a vape. You just insert a cartridge there and then you just inhale it. You like a vape, actually. That's how the doctor describes it. And it's really easy. It's really discreet. You can just put it on your pocket and carry it with you and use it when you need it.
Yeah, another treatment option for people out there. And a doctor you found out here in Austin, Jose, actually took part and helped with a study looking into the effectiveness of this.
Yes, he and other doctors wanted to find out the effectiveness of this drug, and he brought a patient along with him, and she had a unique experience with it.
All right, let's take a look at the story that Jose put together, and we will continue our conversation on the other side.
It is the fastest onset, most rapid acting insulin that we have. I was one of the investigators in the study. It mimics what the body used to do about as close as any insulin. It gets in it quick, it gets out quick. Instead of taking an injection, they just inhaled it in an inhalation. In Megan's case, she's combining the pump, the automated pump, with this.
I always like to do a warm-up breath just to expand the lungs and whatever, but then you just... So I've been type 1 now for almost 17 years. I was diagnosed when I was 13 years old. For the first year that I was diagnosed, I was on multiple daily injections. It's such a difference maker in terms of being able to eat and to live what feels like a more normal life. Diabetes is not a one-size-fits-all disease. I was actually one of the people in the study who did worse on the multiple daily injections and Afrezza. Because of the dosing of Afrezza, I needed a smaller increment of it in order to be able to stay in range better.
It just gets immediately into the bloodstream.
Wow.
What slows the insulin that's given by injection down is that it has to get broken down and absorbed. It's kind of pokey. This is like...
It's about having a lot of different options so people can find what works for them, so that we can have everybody who has an option that they really like, that works well for them.
And we're back here in the KXAN Live studio with our KXAN producer, Jose Torres, who reported that story out for us. And definitely an interesting option for people to consider for those who have diabetes and are maybe looking for a different option to be able to provide insulin. What's the cost of this, and maybe what are doctors suggesting about if someone's interested in getting this?
Depending on your insurance, it might be a little too pricey. So the doctor you just heard from, he recommends talking to your insurance first, your insurance provider, see what they say, and if they're telling you maybe we won't be able to cover it, the doctor recommends you go to your health provider and ask him or her to come up with a solution, and their office can then communicate with your insurance provider and come up with a solution that will help you test this out for yourself and possibly use it on a daily basis.
Yeah, and there is a story up on our website right now at kxan.com looking a little bit more in depth at this treatment option. What else can people find in your story that you wrote up?
We mentioned the side effects. Some people report coughing and sore throats. And also, this drug is not for everyone. There's a link to Afrezza, the maker of this inhalant. It's not for everyone. People with asthma and other conditions, it's not made for them. So I have a link to those specifics in this web story.
All right, everybody. That is KXAM producer Jose Torres, who joins us every Friday to focus on a simple health topic. We've gone from inspiring stories to something like this that can offer a different treatment option for insulin patients. And Jose, I know you have some other stories that you're working on coming up, so we're excited to talk about those too.
Yeah, I could go on and on about this work that I'm doing, and I really like it.
So we'll leave it there and have everybody come back and join us here next Friday afternoon for another Simple Health conversation. Jose, thank you for being here.
Yeah, thank you.
All right, everybody, that's Jose Torres. I'm Will Dupree in the KXAN Live Studio. We will see you back here at another time, and we hope you enjoy your Friday and the rest of your weekend. Take care.